everything that we do will be a reflection upon 6 indicators. These indicators reflect sort of domains of work that we know are inherently important as we think about moving forward in ways to modify our stay-at-home order in a way that minimizes risk. Now remember, this is not about a process that is going to remove the risk from all of us, but it will be a process in which we can think about until that time when we are all protected from COVID-19, at that time where we either have broad-scale immunity or vaccinations or other mechanisms through which we know we can be safe. There is going to be a time where we have to be very, very thoughtful about the way we move. And these 6 indicators, which I have here, are the ones that we've just been reminded about. Again, I'm going to mention them to you, so as we go through, we can understand really how this has informed our work today. So the 6 indicators that we shared with you included the following. First is the ability to test, contact, and trace, isolate, and support those people who might have been exposed. A very, very important tool that we have, in particular, as we're thinking about moving from the first to the second, as was just described to us, stage, and I'll give you more information on this, but really a very important tool for all of our communities to be able to keep ourselves safe as we move around further. The second is the ability to protect those who are at high risk for COVID-19. Those are individuals who are in congregate care settings, or those who are 65 or older, or those with comorbidities that we know for whom, if they're exposed, their risk is much greater. And around everything that we've done, we've made sure that that's been a very central part of our dialogue and our activities. It's also critical that we maintain surge capacity for hospital and healthcare systems. As I mentioned, as we move to this next stage, it's not about removing the risk entirely, it's about minimizing risk. Even as people move in an environment with minimal risk, there is the possibility of increased cases, and we must make sure that our care delivery system is there to support them in need. Therapeutic development to meet the demand is an area that we're working on as well to make sure that we help move the work forward. And then finally, we're going to talk today about the indicator that focuses on businesses and schools and child care facilities, making sure that we support and make sure those environments are safe for them. And that's what this next period is all about. And most importantly, and as I move on to this next slide, is our ability to determine when we may have, that we are moving in a way that's safe and best for Californians, also recognizing that there is some risk involved. So Dr. Galley presented to you this slide that helps share with you a little bit about what at this moment has given us the sense that it is the right moment to start talking about preparedness for a potential modification. And that is a recognition of the way in which, and this is a surrogate marker for the amount of COVID-19 and how COVID-19 might be moving in our communities. We are doing that at this time because of the absence of broad-scale surveillance. We are doing that at this time with something that is an excellent indicator for us at this moment, which is an understanding of trends in hospitalizations over time. And this slide has shown us from the very beginning, first of all, when we introduced our stay-at-home orders. And over this period of time, it appears, and we're watching this cautiously, but it appears that we've reached really a period of stabilization over the past couple of weeks or so, in that the total number of hospitalizations from COVID-19 and the total number of admissions into ICUs from COVID-19 have remained stable. Again, as the governor mentioned, we're watching this carefully, and should that change, that will certainly change the way that we talk about our opportunities to move forward. But at this point, this is the right moment for us to have this conversation with you. So let me move on to what the progress will look like. But a couple of quick reminders. First of all, that COVID-19 is not going away soon. This is going to be a while. But there are things, as long as COVID-19 is here, there are ways that we can modify the way we move around in the environment that will make it more possible, and that's what we're moving towards. So we're talking about modifications in the stay-at-home order, but they will be guided by health risk and our commitment to equity as we think about the kinds of interventions that are appropriate at this time. The final thing that's really important for all of us to remember, though, is that ultimately we all have some responsibility in this. The responsibility exists at all levels, from the individual, from the way you make decisions about the way you move in the environment, from businesses, from the ways in which they change the environment to lower the risk, and ultimately also to government in the ways that we help support and lift up appropriate policies. So the 4 stages that we discussed, the first stage is the stage that we're in. This is the stage where we are all either at home or engaged in the essential workforce. We know that there's work that still needs to be done here before we move on to stage 2, and that is about making the essential workforce environment as safe as possible for all of those who are workers and for any of those who may be staying at home but may be interacting with the essential workforce and with essential businesses as part of doing those activities of daily living that we must do, like going to the grocery store. That's where we are focused right now, and we will continue the work that we are doing across all of those indicators to make sure that we are safe and secure as can be in the current stage. But we are also planning forward to stage 2. So stage 2 will be a focus on those that can be created, those lower risk workplaces. So the goal here will be creating opportunities for lower risk sectors to adopt and reopen. And when I talk about lower risk sectors, which I'll go into a little more detail later, we're talking about things like manufacturing that may not have been a part of the essential sectors that are currently opening. We also in stage 2 will be talking about modifying our school programs and including childcare reopening. The third stage is when we get into those areas that may be higher risk, those sectors that we think will take a lot more modification to adapt in a way that can make them places where people can move with lower risk. So those kinds of environments, we'll be talking a little bit more as well, but we really want to create an opportunity for those, but we know it will be longer in coming. And so that is why those fall into stage 3. Again, those are things like getting your hair cut, getting your nails done, doing anything that has very close inherent relationships with other people where the proximity is very close, and it will be, we need a very thoughtful process to ensure that people don't put themselves at great risk in doing those activities. And then finally, stage 4 is the point at which we know that we can begin to modify our stay-at-home order and have people moving much more freely because the risk is much lower. And that will require therapeutics to be in place. Okay, so safety and preparedness, stage 1, this is where we are right now. The things that we're going to be actively doing is continuing to build out our testing, contact tracing. We're going to be building up our stores of PPE to make sure they're secure not only for our current needs, but also in anticipation of what will be needed for stage 2, when we do begin to open other sectors that may also rely upon PPE. And we'll also be really focusing on maintaining our hospital surge capacity for the time being, but also anticipating that we may need more as we move forward. We'll be continuing to make essential workplaces as safe as possible, as I mentioned. That includes really thinking about the physical work environment that we're in, changing workflows to make sure that people are safe. We're going to make sure that we enhance our safety net for our essential workers, continue to move forward, making PPE more available, and then also continuing to remind all of you in your daily behaviors that there is something for all of us to do, maintaining our physical distance and doing all of those things that we've reminded you can help to keep you safer and at lower risk. In stage 2, we're going to really start focusing on lower risk workplaces. That means gradually opening some of those workplaces with adaptations. These include things like retail, allowing for curbside pickup, manufacturing, which can include things like toys, clothing, other things, furniture that was not a part of the essential sector. Talking about offices, this can include things like PR firms and consulting and other places where telework is not possible, but by modifying the environment itself, it can make it lower risk for individuals. And then ultimately talking about opening more public spaces, things like parks and trails that may have historically been limited because of our concerns, trying to think about how we can modify that to make them safer for individuals to enjoy the outdoor spaces, because we know physical activity is so important to our health, and this is also about health, clearly. And then finally, another area that we need to think about besides the physical environment is really the environment, the safety net itself. So what are we providing for workers so that if they get sick, that they can be supported to stay at home if they need to, rather than feel like there is a need for them to go to work? Then there's the whole environment and of childcare and schools. And so for adults, maybe we talk about, work for adults, and for our younger adults, our children, school is their place that's so important and critical for them and their learning. And we really, really feel strongly that when it's safer for them, when we can create environments that allow them to go back, we do want them to go back. We realize, however, this is going to take more planning, and that's why we are discussing this now, because we need to roll up our sleeves now and be really thinking critically about how to do this. As has already started, we need to continue that discussion and continue it more in earnest. So we're talking about summer programs and the next school year potentially starting sooner, perhaps in July or August. We're talking about childcare facilities and trying to find ways to help them provide more care, to create more childcare availability to our workforce in particular. We think it's fundamental that we focus on this because we have to address learning gaps which have occurred as a result of this. We've been protecting all of us by limiting the amount of access in this environment, but we have to make up for those gaps that may have occurred over this time. We'll be focused importantly on making sure that the environment is safe for kids, but also safe for teachers, safe for others that are in the school, safe for those who are providing essential services and supporting those environments where our kids will be. And ultimately, as we open up schools, as we make sure that, that childcare is more broadly available, it also makes it more possible for parents to go back to work. So school will look very different. But we really are focusing on enhancing those opportunities. So what will we be doing? What do we need to do to get from stage 1 to stage 2? From the essential sector environment that we're in, from the stay-at-home with quite limited engagement, to one that will create more opportunities for lower risk workplaces. So the things that need to happen and that we'll be focusing now together, we'll be first of all focusing on government actions. So what are the kinds of policies that we need to have in place that will allow people to stay home when they're sick? We need to provide guidance, and we'll continue to do that and make it available for how people can reduce risk, to continue to provide people with the best scientific information that we have about this virus to help people prepare themselves, to move into an environment that is not fully safe, but certainly lower risk, so we can all make decisions ourselves in a very informed way. Businesses will need to think more about wage replacement so that workers can stay home when sick. They'll need to be implementing adaptations to lower risk workplaces now so that when we are ready in a few weeks, those changes will be in place. And when the data tells us the moment is right, those environments can start to open. And then we, again, just sort of emphasize that in those places where workers can continue to work from home, we'll continue to encourage businesses to support those opportunities, because really staying. And then what about as individuals? Well, we all need to continue to practice safety precautions, which is a physical distancing, using face coverings when appropriate. We need to avoid all non-essential travel. That will continue on. That's an important thing. That decreases our exposure, our potential exposure to others. And we also need to, as individuals, continue to support and care for those people that we know are at higher risk. Continue to make those phone calls to people that you know are in their home and socially distancing themselves. Continuing to make sure that their needs are met and thinking about how you might be part of the solution for them. So when are we going to be ready for stage 2? So again, we will refer back to those 6 indicators. As mentioned, all of those 6 indicators are not exactly the same. There are some that may be more important to this stage than to stages that come in the future. But I want to share with you some of our thinking now about which elements of the indicators that we've discussed earlier will be key. So first of all, we'll be watching those hospital and ICU trends carefully and thoughtfully, and they need to remain stable for us to remain confident that we are in a position where the stay-at-home orders could be modified in a way that would continue to maintain lower risk. We need to maintain hospital surge capacity so that as we move through to the next stage, we can be confident that if there are any increased infections from increased movement, that we do have the facility to be able to respond and to support and care for those patients. We need to make sure that there is PPE available to support the demands that will come, not only from the existing environment, the existing conditions that we're in, but also anticipating what the needs will be for the future and being sure that we're confident we can secure those. We need to make sure that there's sufficient testing capacity to meet the demand. That's been a key focus of much of our work, and you've heard a lot about our plans. We'll continue to work diligently on that. And finally, we'll be looking at contact tracing capacity statewide. We'll be working with local health authorities and governments to make sure that the capacity is there. So I want to talk a little bit about the opportunity for regional variations, which I know also has been a hot topic of discussion. As the governor had mentioned, and as the state public health officer, I'm in constant communication with local health authorities and understanding really where they are and where their needs and desires are. During stage 2, counties can choose to relax stricter local orders at their own pace. That's very much about what we've been talking about in the Bay Area. The state stay-at-home order is the basis for everyone, but there are some counties in which the local disease epidemiology was such that the local health officers felt that it was important to be stricter. And we appreciate respect, and we think that's exactly the right thing when local health officers understand the needs of their community, that they act appropriately following the science. Similarly here, as we lift and make some modifications in our stay-at-home order, there may be counties that aren't ready to go as fast, and that will be supported, and that is a regional variation, which is absolutely fine. Following stage 2, once we have a statewide COVID-19 surveillance system in place, it will make it possible for us to understand what other types of regional variation might be possible. And the reason that's so important is that we know that this virus doesn't respect boundaries of counties necessarily. And we know that as there are modifications in orders, people move differently across there. We need to understand not only what's happening in specific counties, but what's also happening in surrounding counties to really understand if the disease transmission has occurred and if we can modify in a way that's safe. We'll be working very closely with our local health authorities and governments in consulting for that. The final 2 stages that we discussed are stage 3 and stage 4. Stage 3 is the space that we get into when we're talking about higher risk workplaces, and that's one of the later phases because we know that will take much more modification. We need to know much more about the movement of disease to be able to make data-informed decisions about what's safe for folks. So these include places like personal hair care places, entertainment venues where people are sitting closer together, and sporting events without live audiences. Other things that fall into this space are in-person religious services like churches and weddings. And we'll need to think carefully about what kinds of provisions can be put in place so that people can join, but in a way that doesn't expose them to increased risk for COVID-19. And then ultimately, the space that we all look forward to someday as we move forward and work diligently together is stage 4, which would be the end of the stay-at-home order. And that's when we'd be opening all of our highest risk workplaces without modification necessary at that time, because at that time we will know that we have identified a way that we can keep people safe from COVID-19, either from population immunity or from vaccinations. So with that, I just want to remind you that this is a time not of staying in one place. We are in stage 1, but it's actually an important time of work. And that's why we wanted to give you this opportunity to understand our planning at this time. The first thing I want to tell you is that if you want to be a part of the solution, you need to stay home if you're staying at home. And if you're part of the essential workforce, we want you to stay home when you're not working. That is the best way to protect yourself. But if you do need to go out, to go to the grocery store, make sure that you continue to practice physical distancing and all the other things that we tell you. That's the first thing you can do to be part of the solution. The second thing is that we're enlisting all Californians to help inform the development of the guidance for sectors across our economy. If you're somebody who has particular insight, if you're a business person yourself, you're going to be invited to provide information, and we'll put the website up shortly for you. But we want to hear from you, because ideas that you have about how you can create safe workplaces are ideas that we want to know about. We're going to be providing this guidance and a framework ultimately to help companies, businesses and our schools reopen in the way that reduces risk. But it really will continue to rely upon all of us to keep this moving forward. Thank you.